Hello,
Hello.
my name is Dr. Barbara. I'm FI2 in today's. Uh, can I check your name and age, please?
Yes, doctor. My name is Sarah Beth, and I am 72 years old.
Okay. Sarah, what can I do for you?
Doctor, I'm not feeling well. For the past 2 to 3 months, it's been difficult for me.
Can you please tell me more about your illness, your
Yes,
symptoms?
doctor. I don't know. It's in my tummy. It's something like getting bigger and bigger, and it's not like the normal thing.
Okay. Uh, Sarah, I want to ask few questions. Is okay with you?
Yes, doctor. Yes, sure, doctor.
As you have told me, you have feeling of swelling something in your tummy. For how long you have this feeling?
Yeah, it's been like 3 to 4 months.
And does it start suddenly or it's gradually increasing?
It's the same. It started like 3 to 4 months, and it's the same. It's something in my tummy.
Is it associated with any pain?
Uh, Sometimes there's pain in my lower tummy, but other times it's not like pain. It's not the pain.
Uh, can you explain it? What you feel? What is your feeling regarding your symptoms, your illness?
I don't know, doctor. It's something like there's something in my tummy. I don't understand what's it. I'm just I'm just here to consult it with you.
Okay, okay, I can understand. You are in.
Hello. Hello.
Hello,
Yes, yes. Continue, please.
can you hear me?
Yes, yes.
Okay. Can you please tell me, do you have any bleeding per vaginally?
No, doctor.
Do you notice any weight loss?
I don't know, doctor. My these get cloths are getting loose in the past 3 to 4 months.
And it's intentional,
What do you mean by intentional?
unintentional means your appetite is okay.
Yeah, I am eating well. Yes.
Okay. Do you have the symptoms, any same symptom previously?
No, no. Like it started like 3 to 4 months, and before that, I was perfectly okay.
Do you have any problem with your bowels?
No, my bowels are perfectly fine. I open bowels like 3 to 4 times per
Mm.
week.
Or you have any problem with your water works?
No.
No. Uh, do you have any previous long-term medical illness?
No, no,
Are you taking any medication?
no, doctor.
Tell me about your diet.
It's fine. I eat healthy diet. Like, what do you want to know about my diet?
Uh, and any, please tell me about any illness in your family.
What kind of illness, doctor?
By any chance, any history of cancer?
Yes, doctor. My mother had this breast cancer.
Oh, sorry to hear that. And do you smoke?
No,
Do you drink?
no.
Uh, how many children do you have? Are you married? Sorry.
Yes, I am married.
And how many children do you have?
Uh, 2 children.
And do you take any hormonal therapy
No.
previously? No.
No.
Do you want to tell us anything else regarding your illness? Anything you want to add?
No, doctor. It's just my tummy, and that's it.
Okay. Sarah, I want to do general physical examination and check your observations and want to do an examination of your tummy.
Okay.
I will maintain your privacy and I will provide you a chaperone. Is it okay?
Okay, doctor.
While doing examination, first of all, I ask you to expose your tummy below chest till mid of the thigh, and then I do superficial palpation. First of all, I examine your skin and whole tummy, then I will palpate it, then auscultate with my stethoscope and do a percussion. Percussion is I tap your tummy with my finger. Is it okay? Are you getting me?
Yes, yes, doctor.
After doing your examination and after taking history, I will discuss it with my senior. I suspect that there is something not good with your health, and I would like to refer you to a gastroenterologist, rather gynecologist.
Why, doctor? Why are you going to refer me? I don't want to go to the gynecologist.
I'm suspecting that it might be, as I have done an examination, I feel swelling there, and it must be ruled out for any tumor.
What do you mean by tumor? What is it?
Tumor is some abnormal growth of any part of the body, and it must be examined, investigate properly. As you have told me, you are losing weight, you feel something in your tummy, and you are at the age of 72, so it must be ruled out.
Okay.
Do you want to ask something else?
No, doctor. So what the gynecologist would do?
He will run some test, ultrasound, and might be a CT scan, and might be it needs a biopsy for the swelling.
All right. All right.
Do you add something else?
No, thank you so much, doctor.
Do you have any expectation from other expectation from the consultation?
No, doctor, no. I just wanted to know what is it now. You have said that I need to go to the specialist, so I would go there.
Okay, thank you.
All right, thank you so much. Okay, that was great. Was Dr. Barbara, I think, yes. Okay, so your time is 9 minutes and 30 seconds. Okay, first thing, that was a great effort. Okay. Okay, this is the station of abdominal examination, and it is the lady has this ovarian CA. And remember, in the real exam, she would be when whatever you are going to ask question, whatever the question is, she would be saying that there's something in my tummy, doctor. I'm not feeling well. There's something in my tummy. Sometimes she would say that there is suprapubic pain. Otherwise, she would not mention about the pain. There is something in her tummy. Okay. And second thing is her mother has been diagnosed with breast cancer. And third thing is weight loss. The clots are getting loose. You will get only three things in this scenario in the history part. Okay, now let's discuss about Dr. Babra's approach. Okay, so Babra, you did very well, but the problem is you are taking irrelevant history. Okay, uh, you started well. You asked about when did it start? Was it casual or sudden? Okay, that's fine. And I mentioned about the pain. You did not ask much about the pain. If someone is mentioning about the pain, you need to ask about where exactly it is, when did it start, and is it getting like increasing or decreasing? What are the factors which increases or decreases? You need to mention these things. Okay, these are the important questions. Now, in the beginning, if there is a problem with the tummy, you need to ask about bowels. That you asked about the bowels, that was great. You need to now, if the patient comes with a problem with the bowel, you need to make differential diagnosis in your mind quickly, like IBS, like gastroenteritis. You need to ask about fever, okay, quickly. Now, if there is no fever, there is something in the tummy, and you have asked about the weight loss, and she's saying that I am the clots are loosening. So and the age of the woman is 72 years. It is something serious. Now, in the family history, she has given that her mother has been diagnosed with breast cancer. Okay, so there you need to direct yourself towards cancer pathway, towards cancerous history. Don't ask about diet. Okay, if you are going to ask about the intentional weight loss, you can ask, you can make a question like this. Okay, Sarah, by any chance, are you trying to lose your weight? Like, are you trying to altering your diet, or trying to losing your weight? You can ask about this. Intentional and unintentional is just a vague terms. Okay, now and again from the beginning, when you are asking questions like, do you have any previous illnesses? Ask it like you are asking about the previous illnesses. Mention it, like any blood pressure, sugar, or any heart issues. Mention 2 to 3 conditions along with it. Okay, if she says no, by chance anyone in your family, if you are going to ask about cancer, just give some just give like mention it in the beginning, like by chance anyone in the family has been diagnosed with any serious condition such as cancer. Question like this, the patient should know that something serious is going to ask, the doctor is going to ask something serious. Okay, now okay, you need to skip all the irrelevant history. You need to ask just 5 to 6 questions. You need to spend 2 minutes on on the history. Now the question comes about the examination part. Okay, I'm not sure about if you are just it's because of the online you were repeating the steps, or you will do it in the real exam. What would you say, Dr. Babra? Will you do the like you examine the patient? Will you do similar like in the exam, or it was just because of online?
Might be because of online, because when we do online patient, it's understood that first we do inspection, then palpation, then it's understood. But on telling it verbally, it's quite different.
Yes, that's great. Okay, so how you're going to examine? Okay, first thing is taking consent. Okay, Sarah, now I need to examine your tummy, as there's some problem with your tummy. My examination would involve touching you, and there will be a short one as well. Can I proceed? 2 to 3 words. Do not mention about the abdominal examination steps. 2 to 3 sentences. Now you have taken a good consent. Now go there. So, is there any pain? Examine it and ask, is there any pain? No, there is no pain. Okay. So now you will find there is a fluid in the tummy, in the mannequin. Sometimes, okay, remember, the mannequin comes in 2 parts. Sometimes there is a normal examination. Sometimes there is a fluid in the mannequin. Okay, if there is the fluid there, then you need to shift the mannequin slightly towards yourself, and then do the shifting dullness. Show the examiner that you are doing the shifting dullness. Do this examination in 40 to 60 seconds. Do not take much more time from that. Okay, now you have examined. Now there is a time to explain what have you found in the examination part. Okay, I just examined your tummy, and I am suspecting that there is a fluid in it, and it could be something. It could be as simple infection, or something simple, or it could be something serious. I am suspecting that, as your mother had breast cancer, so I am suspecting that it might be some kind of cancer. If you are suspecting something, don't hide your information. Just go give it to the patient. Like, you are suspecting something cancer because you have found four main things. One is the age, 72 years old women, weight loss, and positive family history, and there's something in the tummy. And on the examination, there is a fluid. So it is confirmed that it is ovarian CA. Ovarian CA patients like this. Okay, now you need to explain it like a breaking bad news. In 3 to 4 sentences, I'm suspecting that it might be something serious, like kind of a cancer. Now, if the patient shows some emotions, if she looks down, give a pause, like 5 to 10 seconds. Then, if she start talking, then it's great. If she doesn't, then you can start like, I understand that this came as a shock to you. I understand that it's a difficult time on you. We are here to help you. Just comfort her. Okay, now she would definitely ask about the management. If she doesn't, then you can mention about the management. And what you're going to manage is the management was Dr. Barbara said it was great. Like, we're going to refer you to the gynecologist, a specialist who deals with such conditions. But what they would do, they would run some specialized investigations like CT scan. They would send some markers, like special test called tumor markers, like CA125. You need to mention it. They will also performing ultrasound scans. Don't worry, if you need any help, we are here to help you. Just comfort patient at each and every point, because you just broke the bad news of cancer. Comfort her, take consent. In this scenario, the important things are shorten your history, take consent, perform examination, and when you're performing examination, ask about the pain, thank the patient, and then in the management part, you need to mention, and when you're going to break the bad news, and you need to comfort her, you need to tell her that we are here to help you, we are here to help you, and if you need any kind of help, you can ask us. So in that way, you're going to complete this station. Otherwise, it was great. So anyone would like to add any other opinion? Yes, please. Any questions so far?
It means, and if we get a station with many, we must focus on examination part and management part rather than history?
Yes, mostly, and almost all of the combined stations would have smaller history parts. In the beginning, you will know that it is some kind of in the beginning you will know, like in this station, in the beginning you will know it's ovarian CA. In other stations, in the beginning you will know about the diagnosis. So you need to skip all the relevant history about the diet, about she's 72 years old. There's no need to ask about menstrual history. There's no need to ask any other thing. Just family history is important, past medical illnesses, any medicines, and smoking. Smoking is obviously, you're expecting cancer, you need to ask about smoking. Otherwise, in the beginning, you need to rule out some 2 to 3 TDs. So it would not take more than 2 minutes. Okay. And in the examination part, you need to be focused examination. Do not perform all the steps of examination. Now she's something in the tummy. Go explain that I'm going to examine your tummy. That involves stretching. There will be a chaperone. Okay, can I perform? Okay, proceed. Go there. I need to expose you from mid thigh to until your above your epigastric region. Now start your examination. Is there any pain? In the first look, in the first 2 to 3 seconds, you have to show that you are just examining the first part, and then about the palpation. To the palpation, ask about the pain, and then come back to your seat explain what you have found after doing shifting dullness, the positive findings only, not the negative ones. Positive findings, then correlate it with your diagnosis, as you explain diagnosis of breaking bad news.
वो तो पिया करें, हर 2 हफ्ते बाद एक पी लिया करें।
तो वो बताया बड़े तरीके से ना।
Okay. So now we are moving towards our fourth station. Okay. So yes, please.
Dr. Junaid, I have a query that while doing the examination on mannequin, we have to take consent from the mannequin or the patient?
From the
We need
patient.
to from the patient. We will take consent from the patient and then we will move on to the mannequin, right?
Yes, yes, exactly.
And while examining the mannequin, do we need to explain the steps?
No.
Or just we
no.
will do silently the examination and just verbalize the findings at the end?
Yes. When in the combined stations, you do not need to verbalize the steps. However, in teaching stations are different. You are teaching someone, then you need to verbalize each and every step. In the combined stations, you will have this mannequin. It would be like this. Let me show you the picture of mannequin if I find anyone. Okay, you can search it on Google in the mannequin, but there would be only a tummy there, and you need to take consent from the patient and then just do these steps. And while palpating, you do not need to like keep quiet during your examination. You need to the one thing, we look into the eyes of the patient. How you start your palpation, you look at the patient and ask, is there any pain? Is there any pain? Just to now you are doing your steps and you are asking about the pain as well. So you have to do this examination like this in just 1 minute. Okay, any question?
Sir, should we verbalize, like we say that now I'm going to touch your abdomen and
No.
now I'm going to expose you?
No
Okay.
verbalization of any steps.
And is there any consent before examination?
Yes, of course, you need to take consent from the patient.
Okay, and then move towards the mannequin and proceed.
Yes, and move towards the mannequin. Now you are standing in front of the mannequin. You just 2 to 3 seconds for the initial inspection. Then start your palpation and start asking patient, is there any pain? No need to mention any step. Okay. Now, if you are this is the mannequin, you are standing in front of the mannequin. Now, 1 to 3 seconds. Okay. Is there any pain? Okay, Sarah, is there any pain? Just let me know if you have any pain. Now you have done your palpation. Now I will be tapping on your tummy. If you feel any pain, just let me know. Start tapping. Okay, and then you need to turn yourself towards me. Okay, now turn the tummy, do the shifting dullness, then place it there. It's like this. If you are if you're going to tap on the tummy, you need to mention it. I'm going to tap on your tummy. If you feel any pain, just let me know.
Okay, sir. Just just like that, we say before palpation.
Yes, just like that. Before palpation, we ask about the pain, and before the tapping, we ask about the I'm going to tap.
Okay, sir. Thank you.
So I hope that's clear. Okay, but if we do not pick any findings, don't worry. There's there with the abdominal examination, there are only 2 to 3 scenarios in that way. In such ways, you need to know that what's the station inside it. Well, you need to practice it. To be honest, when you will be standing outside the cubicle, you would know that it's ovarian CA with the age, with the name. Almost the name and age, they do not change. For name and age, you know that if the patient is 72 years old, she has some problem with the tummy, and then she is a likely case of ovarian CA. And if you do not pick any findings, how you can alter your situation like this? Like in those scenarios, you can mention that I am unable to pick any positive findings. I will call my senior to examine you again. So it will not be, hello, can you hear me? So in those cases, you will involve seniors.
Yes, sir.
Okay, it's fine. So in those cases, you will involve seniors. Okay, that's great.
Yes.
But again, you need to practice. There are only 3 stations that are abdominal examination. One is, I guess, let me repeat those examination scenarios. There is the ovarian CA, abdominal distension with liver cirrhosis, UTI with urinary retention, and acute abdomen. There are 4 scenarios. And when you will be taking history or you will be standing outside the cubicle, you will know that what's inside. Okay. And these findings are not like in the ovarian CA. When you will palpate, you touch the tummy, you would know that there is a fluid in it. That's clear that there is a fluid, and sometimes it's normal as well. So in those circumstances, you will know that there is no fluid. There is a fluid. Your on palpation you would know. And when you are doing percussion, it would be definite. I hope it's this clears. Now we will be going. We're moving towards our 4th scenario, and